My name is Laura Killam. I teach in the first and third year of the nursing program here at Cambrian College, and I'm excited today to talk about some of the changes that have happened in nursing since I started being a nurse. A couple of the biggest things that I've noticed is the increased use of technology. We call those nursing informatics skills, and so students coming into the program need to learn how to use various technologies so that when they graduate, they're able to use those technologies to improve client care, not only in the hospital setting, but in the community as well. Another thing that's become increasingly complex for nurses is the use of social media. I'm talking about Facebook and Twitter, Instagram, all those things. Nurses need to be aware that they're held accountable to professional standards, and they really have to think twice before they post things, and that's something that as students people have to get really used to, and so we try and help our students learn how to navigate those really new challenges.
So I'm Catherine Timmermans, and I'm a nursing faculty here at Cambrian College. I teach primarily in the first year of the nursing program, and one of the most salient things that I've noticed over the course of my career as a nurse in particular is the complexity of patients that we're seeing, not only in acute care settings, in hospitals, but in the community as well. Nurses in today's day are faced with a number of challenges in terms of bed shortages and increased patient ratios, along with those complex needs that those patients or clients may have. So I think that in our program we're looking for creative ways to incorporate placement opportunities for students so they do have a variety of skills when they're getting out there into the practice setting.
With the increased acuity that Catherine was talking about, it's really important that we teach our students to be able to think critically, because we're getting information from a variety of sources and we need to be able to prioritize our care and think of creative solutions to problems that historically nurses may not have had to think of before.
Theory informs practice in many ways. If we look at some of the concepts that are developed by Benner, for instance, they talk about from novice to expert and how that's leveled across our curriculum and our program. So it's important to remember that even in terms of some of the theoretical views on caring, we draw on a lot of those concepts and then we apply them in our practice settings. And sometimes it's hard because we may develop ethical dilemmas or an internal dialogue as to how can we care for individuals to our full potential when we are also faced with many of the demands within nursing, such as the time constraints and technology and the information overload that we're experiencing.
In my opinion, theory, practice, and research are very closely connected. They kind of form a triangle where you have theory, practice, and research on a point of the triangle. When you're approaching a practice situation, it's really good to draw both on some theory and some research in order to inform the decisions that you're making. Likewise, the theory that you're using has to be developed based on questions that are valuable to inform practice. Otherwise, what's the point of having a theory? Same thing with research. Why the heck are you doing research in the first place if it's not going to be used in practice? So it's really important that those three things are connected. The connection between the theory and the research is really that theoretical frameworks are used to inform the questions that we ask in research, and research can either prove or disprove connections in the theories. So I think it's really important as a nurse when you're approaching a situation to think about how those three things should be informing your decisions.